Coming up today, a high school athlete was powering through his pain. We explain the often misunderstood injury and the surgery to fix it, plus the work it takes to get back on the football field. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Take a second to think about your abs. Yes, even if you don't have a six-pack and you do still have abdominal muscles somewhere hiding in there, running all the way from your ribs to your groin. You probably don't realize how often you use your abs unless maybe you've suffered through a hernia or a similar injury. In the summer of 2022, Zach Darsh started feeling pain at the top of his groin, just below his abs. Every little movement hurt, but with college scholarships on the line, the high school senior decided to power through the pain and play football.
After a few months, I started to be able to lift, run. I mean, I still had pain, but I was warned of it, and so I knew I wasn't going to stop myself, so I was able to push through it.
Zach was pushing through a core muscle injury, an injury that has historically been misunderstood. As soon as football season ended, he had a special surgery with a doctor here who developed his own special technique for fixing core muscle injuries. Months after the surgery, Zach was getting back to full strength and eager to play college ball. Thanks to rigorous strength and conditioning plans, we were able to follow Zach during one of his workouts.
All right, so once you get through the ladder, finish with a burst. Ready, go. Pop, 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 pop. Switch, 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 burst. There you go.
I'm Zach Darsh, and I had a core muscle injury.
Ready, go.
At first, it was every movement I did, every subtle thing hurt, and I was like, I didn't really know how long this was gonna last. Playing football on Friday nights, I would do like lidocaine patches, and I would take painkillers. So I mean, I did everything I could to ease it, but I knew the whole time it wouldn't go away.
Here goes Zach, boom. That's it. Slow feed, don't eat.
Ever since the surgery, I've learned a lot.
Nice, Zach.
About how I need to take care of my body. It's been super helpful here with Roger. I mean, it was weeks after my surgery where I was already working with him.
Nice work. My name is Roger Allen, and I'm the Strength and Athletic Development Supervisor for the University of Kansas Health System. Ready, go. Get out of the break. Push. There you go, that's it. Go. Zach has to be extremely agile, being able to go in every single plane and direction. Back pedal has to go backwards, right forwards, lateral, sideways. Good job. Ready. That's the reason why. There you go. That's it. We're doing all these multi-plane. Ready. Push. Multi-directional drills. There you go. That's it. Time to lift. Time to get swole. Let's get it. Easy money. Right now, what we're doing are chain bench presses. It's gonna get easier and lighter as you go down. On the way up, it gets heavier. 1, 2, 3. So this is what this simulates. Coming up down the line of scrimmage, push a big offensive lineman off of them, push, shed, and go make a tackle. Nice. It's all power, quick, explosive, but not a lot of repetitions. There you go. My goal in every training session is to try to get them to smile as much as I can, makes them forget how miserable it is.
Working out with Roger has been an incredible experience, more of a friend than a trainer. He makes me enjoy coming in here. He's kind of just leading me through the little things, going back to square one, and he's built me up all the way to now where I'm doing everything at high intensity.
Abs connect the entire body. Your core, your trunk, connects your legs to your upper body. That's 2. You use your core in everything you do. Good job. Down, slow, try not to swing. You don't really realize how important your trunk is until you hurt it.
I realized that there wasn't many things that didn't hurt it.
Good job. Feel stretching glutes or hip?
Glutes.
There's one ability that's more important than any other ability, more important than strength, flexibility, intelligence. It's availability. Like if you're injured, you can't play. So with that said, injury prevention is the most important thing you can do. That's exactly what cut my career short, was injuries. I finished every season with a surgery. And after my 4th surgery, team stopped calling. I get to live my career vicariously through them, and their successes are my successes. So I get to continue to be an athlete through them.
Once I get to Penn, I want to have great relationships with everyone. I mean, I'm doing everything now to set myself up to see if I can get on the field as early as I can and enjoy my 4 years of playing there.
Call it good.
Let's do it.
That was Zach working out this past summer, and as he mentioned there in the end, he went on to play football for the University of Pennsylvania. He did get some game time even as a freshman, but as we know, life as an Ivy Leaguer, it is demanding. So this morning we are letting Zach focus on school, and instead we are going to hang out with his dad, J.P. Darsh. He's a doctor here in a sports medicine physician with the University of Kansas Health System. Dr. Darsh has, of course, nothing going on, right? Super available. So, but we wanted to let him focus on school, and we're going to talk all about your son this morning. Right next to me is Zach's surgeon, Dr. Scott Mullen, an orthopedic surgeon and sports medicine specialist with the University of Kansas Health System. Someone with a clinical focus on hip surgery, very specified. He's going to help us understand what a core muscle injury is. Great to have you both with us. So Dr. Darsh, just we got to find out, how is Zach doing?
He has done well. He's been completely pain-free for a while and had a great, successful first semester of school and football. So, and he's excited. They're back to starting spring football right now. So things are good.
And played a little bit as a freshman, right? I think we have some photos of him on the field and doing his thing. That must have been a really exciting time.
It sure was, sure was. I had a chance to go, as you see there, I got a chance to go visit him and watch him play, and he got to be on the field a little bit as a freshman, so that's exciting. The next few years should be exciting and fun for him.
And he played baseball, but he's just playing football at Penn. Is that correct?
Correct. Yeah, he did both in high school and in college. Those days are done. Nobody really does that anymore.
Yeah, that's a
lot of time.
Very small percent who does that.
Yeah.
Okay, no Bo Jackson, right? So, also some viewers might remember you because you've been on here because you yourself went on to play professional football. Then you jumped into medicine. Kind of a nice backup plan. You know, go from a pro football player to good, as your parents recommend. Always have a good backup
Correct.
plan. Has Zach said anything about following in your footsteps?
You know, he is considering that. That's probably his interest. He's considering going to medical school, going down that route. And I told him, "Are you sure about that?" It's a long time, but he seems to be pretty much set on that.
Not bad, not bad. All right, so let's jump back into this injury. This was almost 2 years ago. How did you learn that Zach was injured? Did you notice it, or did he tell you?
Yeah, during the summer, he was working out with Roger and playing baseball in the summer, and he started complaining of groin or lower ab pains, what kids usually come complaining of. And, pretty quickly I figured out he had a core muscle injury, and, we tried basic things like resting a little bit, anti-inflammatories, had him in with one of our physical therapists at our performance center, and he wasn't really improving after a few weeks. So I happen to have a friend who's a specialist in that, and
a guy.
is an expert in the country on core muscle injuries, and I had him see Dr. Mullen, and we made the decision to have him play through his football season, and after the season he had surgery.
So I would imagine with all of the movement and all the games, you kind of lose track of maybe how that injury occurred. Does he know the moment in which this occurred or how it happened?
Yeah, he did not have a specific moment, which most of the time it's just something that's insidious, kind of comes on, and the kids start feeling just a little bit of discomfort that tends to grow with like intense activities such as like sprinting, changing direction, things like that. And it's it's once you've seen it, you know how to recognize it. It's fairly easy to recognize, but as we all know, it gets missed a lot.
So he did push through, as we've been saying, and a lot of kids do that, playing through that pain. But and I think Zach mentioned a few of the things that he was doing to try to ease it. Just remind us of what kind of things you were doing to remedy it.
So that type of things that you can do early on is a little bit of rest, right? Physical therapy, and then any anti-inflammatories, either like a gel, anti-inflammatory gel on there, or oral anti-inflammatories like ibuprofen, naproxen, things like that. Sometimes it helps, sometimes it gets better. Unfortunately for him, he wasn't able to really be pain-free, and it's a struggle to play an entire season with that. It's as mental as physical, the physical part, but the mental part of knowing that you're never quite at full speed.
Well, and just for you as a dad, just striking that balance of being the dad on the sidelines watching. You're also a physician. He's got scholarships on the line. He wants to play. What was it like just knowing he was in pain, but knowing what lied ahead for him and his opportunities? Speak to another parent who might have to go through the same decision-making process.
Sure, yeah, and I think as a parent, when your son is going through something like that, I've been through those types of things, injuries, and there's injuries that it's okay to play through if you can tolerate the pain. There's injuries that it's not okay to play through. Biggest thing is make sure you see somebody that that can accurately diagnose the injury. And because again, for him in that situation, it was safe to just play through the pain as long as it's tolerable. Versus there are certain injuries that you just can't do that.
But you also want to reiterate that it's important that kids tell their parents and feel
Absolutely.
comfortable explaining how they're feeling.
Exactly. You got to come and don't suffer in silence. It's okay. Bring it up to your parents, and you have to get diagnosed by a qualified physician that can give you an accurate diagnosis. Then you can make an informed decision on, what route do you want to, is it a route that you need surgery now, a little rest, a little therapy? Is it safe to keep playing on it? And I know for Zach, when he talked to Dr. Mullen and said, if I play through the season, am I going to mess something up? Is it going to be a problem? And he was told, no, it's just pain tolerance and we'll fix it after. So at that point, he just changed his mindset to, he just played and he knew he had pain, but you just, play through it. If you want to play at a high level, you have to be able to do that.
Right. So Dr. Mullen, let's bring you in here. So you get a call from Dr. Darsh. You're also your very good friend and colleague.
Yeah.
What did you find out when you first heard about Zach's injury? What were you told?
Yeah, so obviously Dr. Darsh here can identify a core muscle injury, so he knew what he had, and he brought him into clinic to have me look at him and make sure that what he thought was going on was the case. And we talked about just what JP mentioned. We talked about this is a safe thing to play with. These are the different conservative measures that he already mentioned that we can do. And if you can ride this out and you can make it through the season, we can fix it at the end. And this is one of the safe injuries to play through. One of the few probably sports medicine injuries that happen on the field or the court to play through. But this is one that you can play through. And he toughed it out. He's a tough guy.
So. So tell us what a core muscle injury is. It sounds vague. I worked out the other day
Sure.
for a while, and literally I sneezed the next day, and I thought I was going to die and have to call you, right?
Yeah.
So tell us exactly what it is, where it is, how it happens.
Sure. So a core muscle injury has had a lot of different names. It dates back all the way to many decades ago in England, where there was a general surgeon that started taking care of athletes with groin pain. It's been called athletic pubalgia. It's been called a sportsman's hernia. It's been called a sports hernia, which is probably the most common term that people hear. But the problem is that a sports hernia is a very confusing term because a hernia means that fat or your intestines are kind of coming through a weak spot in your abdominal wall. And the vast majority of the time in a core muscle injury, that is not the case. The problem is where your six-pack attaches to your pubic bone and where your inner thigh tendon, called your adductor longus, attaches to the thigh bone. And they have this opposing shear force. So when you fire your abs and your thigh muscles, such as top end speed, as JP was mentioning, or when you go to cut, those muscles are pulling in opposite positions and they have a common attachment and they can tear at their common attachment.
Is it a pretty common ailment for anybody in sports?
It's a common problem. It's also commonly misdiagnosed.
Does it fix itself? Can it heal itself?
It can't necessarily heal itself. The symptoms can get better with conservative measures, and if you can get the pain to go away with the conservative measures, activity modification or rest, anti-inflammatories, sometimes injections can be helpful, then it's okay to leave it and not fix it. But if it's significantly activity limiting, whether you're a high school, both sides of the football athlete, or you're a middle-aged runner, or you're just a weekend warrior that can't do what they want to do, then fixing it makes sense.
So the limitations can vary from your
Yes.
your level of activity. You told us that it's something that will often occur alongside another condition, something called FAI.
Yes.
What is FAI? I'm going to let you do the honors.
Yeah, so FAI stands for femoral acetabular impingement or hip impingement syndrome. And it's basically when the thigh bone bumps into the socket with different movements. So as the patient flexes their hip up, especially if flexion and rotating their hip in, the thigh bone can bump into the socket, and there's this gasket seal that lives along the edge of the socket called the labrum, as you can see on the screen there. And right as that flexion happens, or that hip bend happens, you can see the red spot there where the thigh bone bangs into that gasket seal, that little triangle, and then it can hit the cartilage too, and it can cause a tear, which is also painful.
So patients don't usually just jump straight to surgery. What other treatments might come first?
Yeah, so especially if they have FAI that comes alongside it, we always start with the things I mentioned: activity modification, anti-inflammatories, and physical therapy. And again, sometimes cortisone injections in the right setting can be very helpful.
So Dr. Darsh, how did you and Zach and your family decide that surgery was going to be the right route for him?
Well, like Dr. Mullen said, is when we tried all these things, the activity modification and the resting, the therapy and all that, it had been a few weeks to months now, and the pain was not improving. Then we pretty much knew that as the season went on, it was going to be inevitable to have surgery. And the good news is that's usually a surgery that has a good outcome. So. And I had one of the experts in the country to do it, so it worked out fine. And I think just knowing that surgery was coming at the end was kind of a relief for him, and it allowed him to really focus on and kind of put it in the back burner and think about playing football instead of worrying about the injury.
Makes sense. So, Dr. Mullen, you can treat both FAI and the core muscle injury. Start us off with FAI. You know, what are we looking at in this video? I want to show that and tell us what you're doing here.
Yeah, so this is a arthroscopic picture, meaning a picture with a camera inside the hip joint, and we've pulled on the leg a little bit or distracted it. And so on the right side of the image is part of the femoral head. At the top left is the labrum, or that gasket seal that I mentioned previously, and then just below that is the cartilage. And so where you see that kind of fuzzy area, that's where the labral tear is, and that's what FAI causes. It causes tears in the labrum or the gasket seal, and that's what causes pain. And so here, this is a few minutes later in the surgery. I have debrided the cartilage tear that you saw there initially, that kind of fuzzy stuff. And then now I've put anchors and sutures around the labrum. And so those white and purple stripes you see that are encircling that gasket seal now, that's the labral repair. And then in this final picture, you can see we've let the traction, or we've stopped stretching the leg a little bit. And the ball is now back inside the socket where it normally lives. And we've restored that gasket seal that really keeps fluid where it belongs around the femoral head and the socket.
So what's all the fuzzy stuff that we see?
So that's just the joint capsule. That's a very common question when I show pictures to patients. That actually is normal.
Good. Okay, we like normal. Yeah. That's a good thing to hear. So when it comes to treating core muscle injury, how does MRI help in that situation?
So that's one of the things that's really helped advance the diagnosis of this problem is our MRI images, and the protocols and sequences that we use now are so much better than they used to be, that we can really identify that this is not an abdominal wall, hernia type problem, but it's actually this common attachment. So on this picture here, you see two white arrows pointing at kind of a dark black structure. Mm-hmm. And just above that, there's kind of a wide conical shaped thing, and that's the six-pack muscle coming down to the bone, and the black you see there is the thigh tendon coming up. And on the right arrow, just in front of that, there's a white line, and that's where the common attachment is lifted up at the pubic bone. So that right there is actually the core muscle injury.
So this could be treated by a general surgeon, but you are an orthopedic surgeon, so how does somebody make that decision as to whether to come see you or someone else?
So historically, this has been treated by general surgeons because general surgeons treat hernias. And so many general surgeons across the world have applied general surgery techniques like mesh repairs and things like that to try to reinforce the abdominal wall. Sometimes they divide a nerve that can cause pain. But that's not necessarily fixing the problem. What I do is I actually release that dark tendon, and then I actually sew that six-pack back down to the pubic bone.
And so you're one of the only few doctors in the country able to do this. So this is where we have to have you explain, why are you so special? Why are you such a big deal?
Sure, yeah. So hip arthroscopy is one of the biggest parts of my practice. I'm an expert in hip arthroscopy. I also happen to do 3 years of general surgery training that most orthopedic surgeons do not do. And so I have training and experience in operating around some of the things in the inguinal canal, such as the spermatic cord and things like that orthopedic surgeons would prefer not to be close to. That's what makes me unique to be able to perform this surgery as well as hip arthroscopy, all under the same anesthesia. So I can fix all of these problems at one time without patients having to have two different surgeries.
Dr. Darsh, did he do a good job of talking about why he's such a big deal?
He did. I told you he's a big deal. I told you right off the bat.
That's how people like us are like, he tells you all these things he can do, and I'm like, he's just a really big deal. All of our docs are. So after this surgery, it went well for Zach, but of course he needed physical therapy. And then it was time to get back to the gym, getting back to his body, getting it ready for college football. It's one thing to have your dad be a former NFL player like Dr. Darsh, but then you go into the gym and then you have your strength coach is also a former pro. So Dr. Darsh, kind of nice to know that Roger Allen is helping your kid get back to the field.
Absolutely, Roger's been wonderful. I mean, he's very knowledgeable in what he does, and I know Zach and most of I'm sure all the kids that work with him love him. He's a very personable, great guy, and he's been through, like you mentioned, he played in the NFL. He's had a bunch of injuries. He understands what the kids are going through, and that's one thing that when kids coming back from an injury, the therapy, the physical therapy after is important, but also the strength and conditioning thing, like the stuff you do with Roger, because you might be done with physical therapy, but you might not be quite ready to compete at a level that allows you to play in a game. And going from 0 to 100 is not ideal. So the progression and the getting your body ready to put up with all the stress that you're going to have during the season is really crucial.
Yeah, it's not just the recovery from this surgery.
Correct.
It's then having to put that into action.
Exactly.
Yeah, getting back there.
Exactly.
So, and Dr. Mullen, must be nice though. God forbid somebody has a setback, you could have a trainer have direct contact with you on, how do we work through this problem, right?
Yeah, we have an amazing athletic training staff in all the high schools that we work with. Our physical therapy program has grown so much in the last several years. Our performance center is amazing, and Roger's fantastic. My son's 13. He's going to be a high school football player here soon, and he works out with Roger too. And Roger's he's amazing at what he does.
Well, we've got some more questions for both our docs here this morning. If you have any questions or comments, use the chat on YouTube or Facebook, tweet us, or email the Medical News Network. The information is right there on your screen. Checking in on the COVID numbers this week, there are 12 active inpatients at the health system as of Monday. That includes 1 case in the ICU, also on a ventilator. And this is the second week in a row with active cases at 12, hoping it gets down into the single digits by next week. But we will point out that inpatient flu cases are actually higher than COVID cases right now. Of course, Dr. Hawkinson always says the pillars of infection prevention follow you where you go. So always practice good hand hygiene and stay home, please, if you are sick. I want to just remind everyone that we are sitting next to a couple of Super Bowl champions. At least that's what it says there on their shirts in this photo. Doctors Darsh and Mullen are assistant team physicians with the Kansas City Chiefs. And they may be a little humble to say so, but they do play a big part in the team's success. So, it's one thing to work on just any old pro team, but what's it like to say you're working with not just the champions, the double champions, going for the three-peat, no pressure?
Yeah, it's JP's obviously played for the Chiefs, but it's an amazing experience. I mean, this was my 4th Super Bowl to stand on the sidelines. 4th out of 5. It's an amazing honor, and it's been quite a ride.
So, Dr. Darsh, do you have that moment to sit back and just have that reflect and have the full circle moment of playing in pro ball, playing at the Chiefs, being on the sidelines, but now they're in a different role? What's it like?
I mean, like he said, it's really fun to be around that, around winning. It's always a really special thing. Going to a Super Bowl in itself is not a normal thing. It's a privilege. It's an honor to be there. One of the things I wish I would have wanted as a player, I got to play in one of them that I ended up losing. And also when I was playing with the Chiefs, I think I was joking to one of the guys recently, I think they win more games in a month than I won in 2 years with the Chiefs. But
well, you're still part of that now. So.
Times have changed.
I was going to say, do you relax in the off season, but then you're off doing your regular day jobs of fixing patients. So what's that like? Just to kind of take that break from the off season for you guys.
Well, it's I wouldn't call it a break, like we're, especially when you get to the Super Bowl for us is, a couple weeks later we're at the combine and then
it's
draft's coming up. Yeah, it never ends.
Yep. Same thoughts, Dr. Mullen?
Absolutely, yeah. It kind of never stops when you play football until the end of February.
Sure. So what do you think you'll tell the grandkids? Sorry to make you guys think about grandkids so soon, but about this era in Chiefs football.
Hopefully it keeps going for a while, and we really talk about a true like like the Patriots won 6 or 7 Super Bowls in the past 20 years or so. Hopefully the Chiefs can do that. It's a lot of pressure. I'm not predicting it. I'm just I'm hoping.
Yeah, hoping. Any thoughts, Dr. Mullen?
I mean it's an amazing organization, and they have such an amazing approach to it, and I think this is going to continue for a while. I don't see it coming to an end anytime soon. All
right, guys. Well, let's get to some questions from our viewers this morning. Back to the surgery. Is the surgery open or laparoscopic? We saw some photos.
Yeah, the core muscle repair surgery is open. I do it through about a 3-centimeter incision, so just a little bit larger than an inch. It's open, but it's a small incision.
How do you prevent a core muscle injury?
Hard to prevent. I think some of the things JP mentioned about, especially young athletes working with Roger, having a strong core, and just doing as much injury prevention as Roger mentioned as possible, is how you do it.
Is CMI surgery just for athletes? Do you find just regular people getting this injury?
Couch potatoes usually don't usually
Oh, good, I'm in the clear.
don't
Good to
usually
know.
get core muscle injuries. It is generally people who have athletic endeavors, again, whether they're high school athletes, college athletes, pro athletes, or if they're weekend warriors, or someone who just goes to the gym a few times a week, that anybody can sustain one.
So okay, we asked about someone knowing, but just again, remind us how somebody would know to seek out an orthopedic over a general surgeon. That's a good question, in the fact that people just don't, there's so many options now on the table, and people want to know, when I pick up a phone, how do I know I'm calling the right guy?
Yeah, I think seeing somebody like myself is helpful, because there are some times where I think patients do actually have a hernia, and in that situation I do send them to one of our general surgery colleagues here in the health system. Seeing somebody, a sports medicine specialist, a primary care sports medicine specialist like JP and some of his colleagues, it can also be a great place to start, because if JP knew what Zach had, he just needed me to fix it. So
That's right. Gene wants to know, is this like the injury that the star player for Marquette basketball, Tyler Kolek, has?
I can't say I'm familiar with that injury, so I'm not sure.
Nor am I. So I know we always get that every time we talk about sports. Somebody brings up some past injury that brings a certain injury to the table, and people now always have that in their head. Like, I remember that guy. Is there a risk of re-injury?
There is. The risk is fairly small. A part of the reason that I mentioned I divide that tendon, or that dark spot we saw in that MRI, is because I've eliminated the opposing forces of the two muscles pulling on each other. I've repaired the six-pack muscle back down to the bone, and I've eliminated the pull from the thigh tendon. That muscle tendon complex has a 4-centimeter attachment, so almost 2-inch attachment to the pubic bone. Only 1 centimeter of that is tendon, the rest is direct muscle. So I can release that tendon, and patients don't lose any power or strength when it comes to top end speed and things like that, and that reduces the risk.
Jeremy said, you mentioned that your 13-year-old son uses the Performance Center.
Yeah.
Is that just for injuries, or what do younger teens do there besides recover from injuries?
Great question. So there's a lot that happens at the Performance Center. We have fantastic physical therapists that are there to rehab injuries and post-surgery and things like that, but there's a large strength and conditioning staff there too. We have athletic trainers that do post-physical therapy rehab. So if you've graduated from your formal physical therapy, there are athletic trainers that are also trained in rehab that can kind of help bridge the gap for you back to sport. Roger is there and does the strength and conditioning stuff. There are group class programs. There are soccer clubs that come as a club that work out there to do injury prevention training. So it is far more than just treatment for injuries. There's a lot of training that goes on there as well.
Well, and last question, when should youth athletes begin sports training beyond maybe what they're getting at school?
Yeah.
I would say that maybe not at 5 years old, but middle school is not too early. It's okay as long as you go with somebody that knows what they're doing, and they won't put the kids in harm's way. And as a middle schooler, you're not trying to lift the big heavy weights and do the 1 rep max squat or any of that. You're trying to just be able to control your body, develop a lot of times it's just body weight type exercises, and kind of learn how to move in a certain way. Because before you start hitting puberty, you don't have much testosterone.
Yes.
You're not going to develop much muscle mass, but you will develop kind of neuromuscular patterns of sprinting, jumping, moving with explosiveness that can definitely be helpful. And again, you don't have to be injured to go to the Performance Center. Like Roger, he's geared towards athletes, and middle school is not too early.
Keeping them from being injured.
Exactly.
Correct.
So can you get a core muscle injury by doing maybe an incorrect workout, working out too hard, working out incorrectly, too much weight?
Not necessarily. I mean, too much weight, it could certainly happen if you were squatting too much or something like that. The most common way this injury happens is at higher intensity activities, change of direction, things like that.
All right, let's get our takeaways today. Dr. Darsh, I'll start with you. Sorry Zach couldn't be with us. I know he's got big things going on. We hope to have him back sometime. But what do you want the takeaway to be from Zach's story?
I think the takeaway is when you have a kid that has an injury, first of all, is getting the correct diagnosis, because that's an injury, like Scott said, oftentimes misdiagnosed, and knowing is it safe to play through it or is it not. Okay, it's okay to show a little bit of grit and toughness and play through an injury within reason, but it's also very important to know what you're playing through, because just playing through pain that you don't know what you're playing through, that could be very detrimental to the future, especially in youth athletes where there's a lot of life left and there's a lot of, for the cartilage injury and stuff like that, those are things you don't want to miss.
Dr. Rowland, what's the takeaway?
Yeah, I think in regards to core muscle injury, I think it's a common problem. So I think if you've seen someone and you're not getting better and you have this kind of insidious groin pain that you can't figure out why it's happening and it's really limiting what you should do, you should seek out somebody that can help you diagnose it. And then, just to piggyback on what Dr. Dar said, I think, if you have a young person who's injured and they're not getting better, that is definitely the time to seek, an evaluation and make sure that it isn't an ACL tear or there isn't a problem that can lead to more detrimental injuries. So.
Docs, thanks so much for being with us today. Great insight, great advice. And thanks to all of our viewers and your questions today. We'll see you back here tomorrow. More research than ever is happening at KU Medical Center. But how do millions of dollars in federal grants trickle down to the everyday patient? I'm Jessica Lovell on the next Open Mics with Dr. Stites. The explosive growth of research into cancer, Alzheimer's, and so much more. And the challenge of translating research into clinical practice. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.